you could just start by telling me your name, position, and organization.
Sure. My name is Dr. Crista Johnson Agbakwu. I'm an obstetrician gynecologist at Maricopa Integrated Health System, where I am the founding director of the Refugee Women's Health Clinic there in Phoenix, Arizona.
Great. And tell me a little bit about the clinic.
Sure. So, just to give you a little bit of backstory, my work in FGMC is longstanding, going back nearly 20 years. Actually, it began when I was a senior in college at Johns Hopkins University in Baltimore, and I was taking an elective course on women in pre-colonial Africa, where we had to research a specific topic relating to women. And I had just read Alice Walker's book, Possessing the Secret of Joy, which touched upon FGM from the standpoint of the character Tashi, and that was my first introduction to this topic. And when I look back on my career, that was actually the defining moment of what has become my life's work. And so I spent the semester studying the historical and cultural underpinnings of the practice. And when I went on to medical school, I had the opportunity to work with Dr. Nahid Tubia and Zainabi Yega at an NGO in Manhattan called Rainbow, which at the time in the mid-1990s was at the forefront of work from a public health standpoint in the United States. And I was just their intern, working for the summer in between my first and second year of medical school. But that was yet another defining moment for my career, because that provided the window into fully getting into a greater understanding contextually of the broad issues relating to FGMC. And that really cemented my goal to pursue a career in women's health. And so I pursued obstetrics and gynecology, and after medical school moved to Washington, D.C., where for the first time these women became my patients. Here in the D.C. area, it's a very diverse metropolis of immigrant women from all over the region, many of whom affected by FGMC. And that is really what started my advocacy and interest in really improving dialogue and engagement with healthcare providers who are struggling and grappling with the myriad of issues and clashes relating to women who have experienced this cultural practice. And so based on that interest, I went on to obtain more training. I did a fellowship at UCLA in female sexual medicine, and then went on to the University of Michigan to really gain formal training in epidemiology and public health and the intersection of medicine and public health as it relates to this practice. So as a Robert Wood Johnson Foundation clinical scholar at the University of Michigan, I really was able to work